Hey, so you've been prescribed a personalized wellness or TRT program and you received all the supplies to your house. Now, what do you do? So keep watching this video. We're gonna go over proper route of administration, proper way to store everything, and then also frequently asked questions. So how to store your supplies. So the first thing is when you receive everything, either they'll be on ice or not on ice. So the first thing you're gonna wanna do is take it out of its container and then check to see if it requires refrigeration or not. Most peptides are going to be refrigerated. If you're just on a TRT prescription, those will just be kept in a cool, dark place, but follow the instructions on the bottle that you receive. If the supply is left unrefrigerated for 24 to 48 hours, it can break down the effectiveness of your prescription. And if it's exposed to sunlight, it can also make it go bad faster. So if any of those happen, just give us a call and we'll give you instructions on what to do next. Okay, so you're ready to give yourself your first injection. The first thing you're gonna do is take the vial out of its container and check and make sure that it's the prescription that you talked about with your provider. If for some reason it isn't the right thing, give us a call, talk to your provider. The dosage that you're also being prescribed is going to be on the bottle. So if you have questions regarding that, again, give us a call, but everything's gonna be listed here. So typically, if this was brand new and you were taking it out for the first time, there will be a little adhesive across the top of the bottle. Typically it's blue and it's sticky, so just peel all of that off. And then a rubber stopper will just be exposed. There will be a small circle inside of the middle of the rubber stopper, and that's gonna be your bullseye. That's where you're gonna hit the center every time with your syringe to draw up the product. But before you even draw up your first supply, you're gonna wanna clean it every time. So alcohol wipes are gonna come with your prescription. There's gonna be a set of 2, and you're gonna use those 2 every single time you give yourself an injection. The first one is going to be to clean the top of the rubber vial. So every time you inject, it's gonna be really sterile. The second one will be used to clean your injection site, whether it's the deltoid, the quad, intramuscular injections. We're gonna keep everything really clean. Okay, so we're gonna clean the top of the stopper first here. So we're just gonna give it a quick wipe. And then next we're gonna draw up our dosage. So today this is just an example. This is a peptide called TB500. I'm just gonna be drawing up 20 units, which is an average dose. In an insulin syringe, it's dosed 100 units, which is equal to 1 ml. So 20 units will literally be drawn up to the number 20 in the syringe, just so you can see it. This is clear, but we'll show you a close-up. So I'm gonna pierce the center of the bullseye right here, and then I'm gonna flip it over vertical so all the liquid is at the bottom. You might have to move the syringe downward a little bit, but as I draw back, it flows into the syringe, and I'm just gonna go to the 20. If you draw too much and go to the 30, just push it back in just so it's at the number 20, and then you'll just let go of the stopper and pull it directly out. And none of it falls out, and now you have your dosage ready. So now you're ready to give yourself an injection. We just drew up our dose. What I would recommend is just placing the cap back, sitting upright on a hard surface so that when you're done with your injection, you can just recap the needle. So what I'm gonna do next is just clean my treatment area. This is an IM injection, which means it's intramuscular. So I'm going to be doing it in the deltoid today. If someone else was giving you the injection, whether you're in the clinic or at home, you would be wearing gloves. But at home, we understand you won't have gloves, but it's just giving it to yourself. So you're gonna pinch up the muscle here. You're just gonna give yourself a quick poke like a dart. 1, 2, and then you're gonna push it in like this. And we draw out, and you're just gonna put it face down on a hard surface. And we have a sharps container here, but if you don't have one at home or have access to one, we recommend just putting it in like a glass mason jar, at the Tupperware container, and then contacting your local pharmacy for the closest sharps drop-off point. So if you've started your treatment regimen and you have any questions regarding it or anything to look out for, whether you're starting to have injection site reactions or increased sensitivity or anything like that, just give us a call and leave a message with your provider and we'd be happy to get back to you. So good luck with your regimen. We can't wait to hear about all the results, and cheers to a better you.